Hi, I'm Dr. Nicolai Lennox, and I want to talk about a slightly uncomfortable thing. Self-medication. So, what's self-medication mean? Well, it generally means when we're using a substance, like food, or shopping, or alcohol, or medication, to change our emotional state. Now, the problem with that is it's usually not the right tool for the job, and it has consequences that produce things we don't want. And that's why it becomes an issue. How many of us, after a difficult day think, well, I've had a pretty hard day. I'm a pretty good guy. I deserve to have a drink today. I deserve to have some ice cream. I deserve cookies. I deserve a burger because I haven't had a burger in a while. And it's not really a response to an internal appetite from your body saying, I need these specific nutrients, which is an interesting state. It's more of a thing about, I have an emotional thing I'm uncomfortable about, and I would like to take some substance to change or avoid that emotional state. And you know what I'm talking about, even though it's uncomfortable. What I'm telling you is this: that behavior has consequences. We all know it to be true. You know that if you overeat a certain kind of food that isn't designed to be overeaten, or if you overdrink a certain substance that isn't designed to be consumed in large quantities, you're going to have physical and emotional consequences from it. So what I offer you is that sometimes when we have different symptoms that we're complaining about, maybe we have a neck pain, maybe we have digestive distress, maybe we have headaches, maybe we have low back pain, I'm going to be looking and seeing if there's something that we're doing on an ongoing basis that might be promoting it. And sooner or later, we're going to run across the uncomfortable area of self-medication. I have people who come to me who want to begin to change their lives and change their health habits, yet they're stuck on this issue. I don't have time to have good food, and they eat too much fast food, and as a result of eating too much fast food, they have the very symptoms that they're coming to me to see if I can help them with. And at some point, we sort of have to identify that as a form of addictive behavior. So what's addictive behavior? Addictive behavior is we get ourselves into a circumstance where we continually begin to do the things that don't work for us, don't solve the problem, yet we do them over again and again. And I'm not talking about the glamorous issues of addiction. I'm talking about the simple issues of addiction that exist in dietary stuff. Usually we find it in the forms of sugar. That's the most common thing. Or the glass of wine at night. There's nothing wrong with a glass of wine at night. However, there's some physiologies that don't tolerate it very well. And that's not to say that they wander off into alcoholism. It's to say that when they drink alcohol, their body produces symptoms that are uncomfortable. Their neck hurts, their middle back hurts. They get more inflammatory response. Their hormones get more out of balance. They don't think the way they want to think. And so one of the things we look at when a patient comes in to see us is, are you doing repeated behaviors that are in fact promoting your symptoms? And we can't always just start off on our first visit, on the first exam, and go right at that because it's uncomfortable. We have to wait for you to develop a certain amount of confidence in our relationship as doctor-patient before we address that. Because it's not about being right or wrong. It's not that you're wrong for doing that or I'm wrong for doing that. It's if we can identify the issue, then we can bring things to play that give us alternative ways of dealing with that. It is true, sometimes I will send people out for counseling because there's an emotional issue that comes out that people are trying to deal with in a dietary fashion, and that's just never going to work. Sometimes the emotional issues are there because the diet's so off that there's just not enough skill set left in the body to manage the stress of the emotional stress. So what I do is evaluate you and find out, is that a feature that we need to deal with? Are you, the patient, using substances to change your emotional state, because you're tired, or because you're happy, or because you had a hard day, substances that are promoting the problem that you're asking me to help you with? And that's how we deal with sort of self-medication. I medicate myself, so I behave differently, I feel differently. And that's not really the substance that food is designed to be. Food is designed food is designed to give us nutrition. It's not designed to change our emotional state. So, I hope this isn't too uncomfortable. We'll probably have to deal with it sooner or later, one way or the other. Thanks.